मैं भारत माता के पवित्र चरणों को स्पर्श करता हूँ और उनको प्रणाम करता हूँ. On the occasion of the 23rd Cancer Survivors Day, the dignitaries who are sharing the dais with me, our people-friendly, dynamic, and always touring. Our governor has completed his tour in all the districts of Rajasthan, and he has visited almost all the universities of Rajasthan. And our Honorable Governor of Rajasthan, Sriman Haribhai Kishan Rao Bagdeji, our Honorable Health Minister, who has very nicely presented how the healthcare can be taken care, and his dynamism, and he is ready to help both the private and the government sector, and he is always inviting the precious suggestions from the doctors will be heard, and we are ready to implement it.
This open-heartedness is going to create a big change in the healthcare. Our Honorable Health Minister of Rajasthan, Sriman Gajendra Singh Khimsarji, Chairman of the Bhagwan Mahavir Cancer Hospital, Sriman Navarattan Gothari ji, Vice Chairman of the hospital, Sriman Sandeep Kothari ji, Srimadi Anila Kothari ji, and Sriman Sanjay Kothari ji, the Executive Director of the hospital, retired Major General S.C. Parekh ji, who has presented nicely about the hospital, about how to coordinate everything together. Bhaiyon and Behno, sabko namaskar. I first salute the doctors of this hospital and the staff of this hospital for running this hospital in a big way, so that today we are able to see so many patients who have recovered from cancer. And I want to introduce my Principal Secretary, Mr. Amit Kare. And we are in Uparashtrapati Bhavan, we are trying to make a coordination among the top cancer hospitals of this country, so that we should all work together for the betterment of the cancer patients. And he will be in touch with, we are trying to create a think tank, because I have opened the Jubilee Cancer Hospital in Trichure, and I was closely working when I was the governor of Maharashtra with the Tata Cancer Institute and the Reliance Hospital Cancer Division. So we have to bring a coordination and understanding, so that the latest developments, what is coming up in treating the cancer patient, should be shared by us. Everybody should have the latest knowledge, and we have to equip ourselves. This is the idea behind it. And when I was the governor of Maharashtra, there were one German doctor and Indian origin German doctor. He is a German citizen. Both of them came to me with the Tata Cancer Institute former director and a Reliance Reliance Hospital doctor. They all said that instead of chemotherapy, a replacement is coming up with a tablet. That was a great surprise, and a very good surprise to me, that we have to coordinate all these things, what are the fastest development coming across the world for treating the cancer patients. Our governor has said he is not a doctor. I am also not a doctor. But we can make an awareness among the people that they should avoid tobacco, smoking. Most probably now another big headache is coming up, that is fast food. For the tasty, they are adding so many chemicals that should be avoided, that awareness can be created. And he has well said about the purity of the water. The protected drinking water should be totally protected. These are some areas where we can work, so the chances of getting the cancer for the people can get reduced to the maximum level. Apart from that, cancer is coming. I am not denying it. So we can avoid where we can. And sometimes the cancer comes to some patients in spite of all these things, that it has to be fight it out. And today we have gathered to celebrate a day of unwavering hope and the extraordinary courage of the human spirit at this Cancer Survivors Day. It is not only that a patient has to fight medically to get it cured, he has to fight it out psychologically after it is getting cured. That is more important. And today, this type of celebrations definitely give lot of mental strength for them, and they will spread the news that everything can be fight it out, and we can fight against the most cruel disease also. That confidence and psychological strength in the mind is very important. Not only the medicines, the mental strength is also important to fight against the cancer. So this Cancer Survivors Day is very important in promoting the psychological strengthening of the patients. I appreciate the Bhagavan Mahavir Cancer Hospital and Research Center and the KG Kothari Memorial Trust for organizing such a celebration. Since becoming operational in 1997, the hospital has rendered exemplary service in the field of cancer care, touching countless lives through its dedicated and compassionate treatment. Every year, the number of cancer cases is increasing in our country. The ICMR's National Cancer Registry Program projections show that there are over 15 lakh cancer cases. The government, under the visionary leadership of our Honorable Prime Minister, Sriman Narendra Modi ji, has launched several measures to combat the cancer. Robust policies, strategic interventions, and financial assistance schemes to enhance the prevention, early detection, that is very important in cancer. Early detection is a must. Unfortunately, cancer never gives some pain in the beginning. It gives all the pain at the end. So that is the reason why the people are not coming forward to have a test in the very beginning itself. So early detection is a must, and the treatment will be much easier. And the patient care nationwide have been introduced. During the last year, under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, more than 68 lakh cancer treatments amounting to over 13,000 crores of rupees have been provided by Sriman Narendra Modi ji. Notably, nearly 75% of these treatments have been availed by the beneficiaries in the rural areas. That is another big milestone. This clearly underscores the scheme's vital role in bringing healthcare gaps and extending critical cancer care to underserved population. The central government has remained deeply responsive to the challenges faced by the cancer patients, particularly in the rural and semi-urban areas. To bridge this geographical gap, the central government, in consultation with states and union territories, has taken the establishment of daycare cancer centers in district hospitals over the next 3 years. This is another welcoming trend, and we must all utilize these all facilities. More than 450 such centers are already operational, bringing essential cancer care closer to the communities. The National Health Mission has also rolled out a comprehensive initiative for the early screening and management of many diseases, including cancer, through Ayushman Arogya Mandirs. We have also enhanced the availability of life-saving treatment at the grassroots levels by including anti-cancer drugs in the essential drug list as district and subdivisional hospitals. So slowly it is getting decentralized and it is reaching out the people. One of the most significant initiatives of the central government has been its focused efforts to combat cervical cancer among women. Cervical cancer, as we all aware, remains the second most common cancer affecting the woman in the country, which requires urgent preventive interventions. In February this year, the Honorable Prime Minister Shriman Narendra Modi ji marked a major step forward in cancer prevention by launching the nationwide HPV vaccination program, as it is mentioned by our Health Minister in Ajmer. This landmark initiative aims to provide vaccination coverage to over 1 crore girls. So these type of initiatives are really making a big change in the healthcare system of our country. I appreciate the Ministry of Health and Family Welfare and the Honorable Chief Minister of Rajasthan, Sri Bhajanlal Sharma ji, for their dedicated efforts in advancing this vital public health care. Friends, a cancer diagnosis can shake the very foundation of life. It brings uncertainty, fear, and immense challenges in the minds of the patient first. Yet today, here we have individuals who have faced the storm and emerged stronger, braver, and more resilient than ever before. That is what we are seeing by the great people who are fighting against the cancer, and with a smile, they are giving a lot of inspiration to us. I am told that every year, survivors from Rajasthan and neighboring states come together and share their inspiring journeys. That is more important, because we always feel when agony comes to us, that is we only got, because we don't know the agony of others. When we are sharing, that we get more extra mental strength to face it. Dear survivors, you are the warriors who have endured countless battles, both physical and emotional, and you are here after overcoming the cancer. You have shown us the strength is not in the absence of fear, but in the determination to move forward despite it. Yes, everybody will get a fear, but how to overcome it, that is the greatest fight. But once you overcome the fear, then the treatment will be much easier. Behind every survivor present here, there is a story of perseverance, of long nights, difficult treatments, and moments of doubt. But most importantly, you radiate the message of hope and refuses to fade away. That is the greatest success of these survivors. Your stories carry hope for other families. Yes, you are an exemplary example. It is a message of gratitude to the doctors and caregivers who worked tirelessly with compassion and dedication. I appreciate the Bhagwan Mahavir Cancer Hospital and Research Center for providing cancer survivors with a meaningful platform to share their journeys of courage and hope. This hospital has